My name is Erick Eiting. I'm the medical director for the emergency department at Mount Sinai Beth Israel and the Urgent Care Center at Mount Sinai Union Square. And I'm also program director for the LGBTQ Medicine Fellowship at the Icahn School of Medicine at Mount Sinai.
And hi, I'm Dr. Antonio Urbina. I am the medical director of the Chelsea Comprehensive Clinic of the Institute for Advanced Medicine here at Mount Sinai, and also the principal investigator for the Clinical Education Initiative Education Grant.
We want to welcome you to Pride Month. It's June, and it's a time for all of us to celebrate. We wanted to take just a moment to talk to you about some really important topics on the issue of LGBTQ health. So Dr. Urbina, one of the topics that comes up frequently is the idea of STI testing. Who is it that really should be thinking about getting tested for sexually transmitted infections?
Yeah, that's a great question, Eric. I think anyone that is sexually active should be considered for sexual health screening. Obviously, there's going to be certain groups that may be more at risk for sexually transmitted infections, but it's as often as you feel that there is risk, I think it's appropriate. So typically at Sinai here, we offer screening every 3 months.
And what are the tests that people should be thinking about getting when they're talking to their doctors about STI testing?
Yeah, that's a great point too, because I think a lot of the testing is just based on doing tests in the urine for kind of genital-based sexually transmitted infections. But I also think it's important to screen at what we call extragenital sites, like the throat and the anal rectal region. And that's especially important because oftentimes someone can have an STI in those compartments and they don't have any symptoms at all. So the only way that you're going to be able to detect them is if you actually swab or screen those areas as well.
Yeah, we think of that as the triple site testing, right? I mean, you want to make sure that we're looking at all of the places and spaces that some of these bugs might be hiding.
Yeah, absolutely. Yeah, we call it, 3-site testing. So that's kind of our default, is that we offer this 3-site testing to everyone. And then we just kind of tailor it to wherever there's been any exposure. Those are the sites that we test. And in addition to doing the swabs, and those are typically for like gonorrhea and also for chlamydia, we also draw blood to test for syphilis. Other parts of sexual health screening that we feel are super important are also vaccines and immunizations to protect against sexual health related pathogens. So a couple of those that are super important are meningococcal vaccine to prevent against meningococcal disease, in particular meningococcal meningitis. Meningococcus is a bacteria that can cause inflammation to the spinal column, and that can be quite serious. So there's a very easy and effective vaccine that can be given. And the other vaccine that is not only preventative against STIs, but also to malignancies or cancers is the HPV vaccine. And we strongly encourage that everyone, regardless of gender or sexual orientation, get that vaccine, not just to prevent against infection for the human papillomavirus, but also to potentially prevent anal, throat, cervical cancers as well. So Eric, one of the things we want to talk about now is the importance of HIV testing. So how do you typically counsel patients about HIV testing, and how often should they get tested?
Yeah, that's a great question. In fact, this is something that we do that we offer to patients every time they come to the emergency department. The reality is we don't know, in having some of those initial conversations, which patients might be at risk for HIV. So it's really important to make sure that we're not using any kind of judgment, that we're understanding that it's possible that anybody could potentially have this infection. So using that as sort of a frame of reference. But when we start to think about what are some of the risk factors, we know that this is a sexually transmitted disease. People who've received blood transfusions are not considered to be at risk like they once were, but it is a bloodborne infection. So these are all things that we have to think about. Also, people who are using injection drugs, that is also a mechanism where we can transmit this. And we say anytime they come to the emergency room, this is something that should be offered. But the reality is just as you mentioned before, these are the same kind of tests that we should be doing probably every 3 months for people who may be at risk for HIV transmission, because it's really important for everybody to know their status.
I think that makes a lot of sense. And I think that's a great approach. How do you kind of communicate a positive result to a patient?
You know, I have to tell you, even before I was a doctor, I was doing HIV counseling and testing, and telling somebody that they are HIV positive when they don't already know that is probably one of the most difficult conversations I can think of that I've ever had in my life. I think it's really important to start out by reminding people that this is something that we in the medical community consider to be a chronic disease that is oftentimes well managed with medication, with treatments, and making sure that we're taking care of ourselves and seeking the medical attention that we need. So I think it really starts there, and making sure that people have the support system that they need in place. Even though it isn't the same kind of disease that we thought it was 10, 20, 30 years ago, this is, you know, this can be news that's difficult to hear.
Sure.
So making sure that people have that support system in place to make sure that they're able to manage this transition in their life, and they can be supported after finding out this news.
Yeah, I think that's super important. Just our oldest patient living with HIV in Sinai is 92 years old.
That's amazing.
Still, like, people can really live with this disease. So I also love to really instill that optimism in that this is something that they certainly can live with and live to a very old age.
And it's absolutely amazing. The idea of somebody living to 92 years old with HIV 30 years ago was something that was totally unheard of. So that's really amazing.
Agreed.
And one of the strategies that we've started talking to patients about, even in places like the emergency room and in urgent care centers, is thinking about the idea of PrEP, right, or pre-exposure prophylaxis. So, you know, when we identify those patients who may test positive, we want to make sure that we're getting them started on treatment even the same day that they test positive if possible. So that's a really important connection. But even patients who end up testing negative, it's important to have a conversation with them so that they are thinking through their best prevention strategies. And for a lot of patients, that does mean PrEP, especially now that we have new options like a long-acting injectable that may be a nice alternative to having to take a pill every day.
Yeah, absolutely. I mean, I think the technology has really advanced so much, and there's so many additional tools for all types of different populations, sexual orientations, gender, in terms of what tools fit best in terms of preventing HIV. So just as you mentioned, we have these long-acting injectables now that's an antiviral that's injected intramuscularly in the kind of buttocks, and it's given every 2 months, and it provides protection over those 2-month periods. So again, I think for people that find it difficult to be reminded to take a tablet every day, this is something that they can basically do, and then have these protective levels that will last for subsequent exposure. So I think it's all about empowering patients about taking steps that best fit into their lifestyles for prevention.
I completely agree, right? And even the idea of having to carry around your medication. Let's say you're going to go on vacation. It's summer now, right? The advantage that you can have in having a long-acting injectable. But Tony, what do you think? I mean, is there a downside to taking a long-acting injectable? Are there things that we got to think about or talk to our patients about?
Yeah. So like one of the, and I wouldn't say it's a downside so much, but the reason why they are long-acting is that they stay in the body for long periods of time. So if one were to decide to stop, these drug levels of the medications will continue in the body for up to a year. And after about a couple of months, they'll kind of drop to below a level where they stop being protective, yet they're still present enough that if somebody should still convert, that they may develop drug resistance. So I would say that that's kind of the only caveat, that if patients should decide for whatever reason that they should interrupt, that they should then consider converting to an oral therapy if they're still at ongoing, risk for HIV. But other than that, some injection site reactions, but those seem to be pretty mild and they get better over time. So overall, I think they're really well tolerated.
Those are really great points. I'm glad that you brought that up, and you're exactly right. It's about finding the right solutions for everyone, and those solutions are going to be different for each individual. Tony, you mentioned now that we have elderly patients. You talked about this 92-year-old patient who you have was living with HIV. Are there any particular things that we need to be having conversations with some of our older patients who may be living with HIV?
Yeah, no, that is a great question. And one of the things is that just with persons aging with HIV, they do tend to exhibit a little bit more vulnerability and frailty because of like surfing with this virus for so long. So a lot of the big issues that I find are kind of some of the psychosocial issues. So issues of like depression and loneliness and isolation. So I think that's a big issue that I talk to my patients about. I think you referred to this earlier about support systems that these elderly patients with HIV can have. And because it does tend to cause a little bit more inflammation in the body, we also screen more aggressively for things like decreases in bone density, heart disease, and then also a little bit more aggressive screening in terms of malignancies. So getting in those colonoscopies, if they were a smoker, kind of doing those CAT scans of the lung, because any cancer or malignancy that we can detect early, then we can prevent it from metastasizing. So again, I think we just are just a little bit more aggressive in terms of our like management. But I do think that a lot of the psychosocial issues are as equally important.
You mentioned the idea of isolation and the importance of socialization. Is that something we need to be thinking about more broadly throughout the community, particularly during Pride Month?
Oh, yeah, absolutely. And I know that this is an area that you're very passionate about and very interested in. But no, absolutely. And, you know, I think we do have higher rates of kind of like coexisting issues like depression and substance use disorder and things like that. And I think that they are very common within our communities. And I think it's one of the areas that we really need to, as an institution, kind of reach out to our community to better serve them. So I kind of wanted to flip that around to you and just say, what are some of the big kind of mental health issues that you see in our LGBT community? And what kind of steps are you taking to address them?
I think it's such a timely question right now because we are seeing just an increase in people seeking mental health and additional psychosocial support, especially related to what we've been through in the past few years. We're seeing more and more people coming to places like the emergency department for mental health reasons. So I think it is important for us to sometimes take pause and take stock and remember that even though Pride Month is a month of celebration and to acknowledge how far we've come, we have to remind ourselves that it can often be a time when it really enhances isolation for patients who are feeling that as well. The other piece that you brought up is substance use disorder. And I think that that's a really important thing for us to talk about in Pride Month. We know that part of celebration may include the use of different substances. And it's really important to make sure that we're having the conversations with our patients to talk about how challenging and dangerous they can be, that we're reminding them of resources that are available. We're encouraging them to seek assistance if they're worried about some kind of substance use disorder. So these, I think, are really invaluable conversations and so important for us to have during this month of celebration.
Yeah, absolutely. And Erick, I am going to agree with you more. And are there any specific resources that you would recommend or want to highlight during this Pride Month?
Yeah, absolutely. I mean, as you know, Tony, Mount Sinai has pretty robust resources around addiction medicine at many of our campuses, particularly the Mount Sinai West, Mount Sinai Downtown, some of the areas where we know we have a larger population of LGBTQ patients. But to be honest with you, getting care anywhere across the Mount Sinai health system, you will have the same access and opportunity to take advantage of those resources. And part of the difficulty in seeking care for addiction medicine is this is still an area that's very stigmatized. And so sometimes patients aren't comfortable coming to the same place where they get their medical care. And I think we just need to be mindful of that. There are all kinds of resources all throughout the city, but the important piece is make sure that we're supporting our friends and our colleagues in addition to supporting our patients. Have those conversations. It's still really hurts me to know that there is an increased amount of mental health, of depression, even attempts at suicide all across the LGBTQ population. It's really important for us to focus especially on our transgender and gender diverse patients, because even within the LGBTQ community, oftentimes the risk can be even greater within our transgender and gender diverse patients. So making sure that we're having those difficult conversations. And it's like they used to say, if you see something, say something, right? If you hear something, say something. If something is not off and somebody is alluding to something, let's take a minute and make sure that we're diving into that to understand really what's going on with our patients and make sure that if we need to, that we can get them connected to the resources that they need.
So, Erick, I think we've covered a lot of ground: STI testing, HIV, mental health, substance use disorder. Are there any other unique concerns about the LGBT community that you think are important?
One of the things that I think it's really important for us to remember is, although, LGBTQ and we include the I's and the A's, and there are all kinds of letters in that equation. And even though the L is first, this can oftentimes be a community that's forgotten with respect to healthcare, right? And Tony, at the Institute of Advanced Medicine, a lot of the resources that we have for our LGBTQ patients, sometimes the origin of that focused around HIV and AIDS, right? And in our transgender and gender diverse communities, a lot of the care focused around access to gender affirming care. But we haven't necessarily had the same natural ways that have brought together the lesbian community with respect to healthcare. So it's really important to make sure that we're still using this as an opportunity to make sure that we're reinforcing the important issues. So things like breast cancer screening, cervical cancer screening, and all of the other things that we've talked about, it's really important to make sure that we're having those important conversations. And I say, what better time than Pride Month to say, let's do some outreach to our lesbian patients within the community and use that as an opportunity for them to get access to these really important screenings that we've talked about.
Yeah, I think that's great that you bring that up. I think it's important that we address all of the kind of letters in the acronym. So I think that's a really important point. So I think a final question is, and I think you alluded to just with our transgender health. So here at Sinai, we do have the Center for Transgender Medicine and Surgery, I think, which is the largest program in the country that addresses just not the gender affirming surgeries for patients, but also primary care issues. And I think one of the things that I'm most passionate about too within this program is just our that we really do our good organ inventory. So that we really have a conversation that's very gender affirming with patients about what organs they have and what organs need to be screened. And the importance about doing that in a very kind of affirming, respectful way. So that, for example, trans men who have reproductive organs can feel comfortable going to a gynecologist, or for having cervical cancer screening, or if there is breast tissue to be screened, that it's done, I think, in a very respectful and kind of way that doesn't cause, dysphoria. So again, I think we're really trying to enhance ways to provide really excellent cancer screenings, and just making sure that, I think you talked about that, like stigma doesn't get in the way of having people live their fullest lives.
Yeah, absolutely. And I don't mean to be political, but I think it's always important to acknowledge the environment that we're dealing with. We know that there are places across the country we're seeing more and more anti-trans legislation. And it's, we don't necessarily have to have those conversations with patients talking about politics, right? But we do have to acknowledge certain political realities. And when we talk about things like minority stress, when we see it, in the midst of Pride Month, that we're seeing more and more of this type of legislation being passed across the country, and we're seeing people in places all across the country who come to sanctuary states like New York to make sure that they continue to have access to gender affirming care for themselves and their families and their loved ones. It's just important for us to acknowledge that that's out there, and just recognize that, to incorporate that, and make sure that we're using the principles of trauma-informed care whenever we're talking to our patients about important things like their healthcare.
I couldn't agree with you more, Erick.
Tony, I have to say, this has been really great. I could not be happier to work at any place else other than Mount Sinai, because, while no place is perfect, I have to say, we do some really amazing things for our LGBTQ community. I know that you know that already. And it really just reinvigorates me that we have this opportunity during Pride Month to really celebrate our patients, the LGBTQ community, and really talk about the important aspects of LGBTQ health.
Excellent. Great. And thank you for allowing me to be a part of this.
Thank you for allowing me to be a part of this.